Hi, everybody. This is Heather Korbulik. I'm sorry for the technical difficulties. Hopefully you can hear me now. Is that working? Yes. Okay. I really apologize for that. For some reason, my phone was not muted or was not unmuting. I am on the road today, so hopefully you can just bear with us as we kind of embrace technological difficulties. Okay, so for your information, I'll back up and tell you that I would really appreciate everybody, please mute your line. We're getting some feedback. So if you could please mute your line so that everybody can hear, that would be very much appreciated. I'll back up here on our agenda because apparently you couldn't hear me talking about it. So today we're going to go over our progress to date on our transition. We're going to talk about technology and call center. We're going to talk about the designation of exchange enrollment facilitators and brokers, and about designated agent brokers, and then our EEFs and how they're able to contact our service line. We'll talk about MindFlash training and curriculum. We'll talk about how to set up your profile and our process of certification. We'll also be talking about designating a broker prior to open enrollment and how to designate a broker. We've created a video. We'll talk about how you can accept pending designations if you are a broker. We'll talk about brokers and EEF resources that are available and when they'll be available, some key dates on what's going on as it relates to enrollment professionals, about our BrokerConnect tool, about consumer communication, and we have some really important information to share about consumer communication, so I hope you will stick around because we just got some notice today that I need your help on. And then we have some Q&A and lots of it, so let's move right along. As I said, my name is Heather Korbulik. I'm the Executive Director with the Silver State Health Insurance Exchange. We have Ryan High, Rosa Alejandre, Rebecca Mazo, Janelle Davis, Katie Charleston, who's helped set this meeting up, Eric Watt, our Project Manager, and Athena Cox, who's our Quality Assurance Officer. Let me give you a quick, brief update on what's going on in terms of our transition related to technology. We are in the midst of finishing up our quality assurance checks. So going through and doing user acceptance testing and quality assurance testing on the Get Insured product. We're continuing to do some electronic data interchange testing with carriers that did not participate in the previous plan year. On October 1st, CMS will send us another catch-up file of data from the healthcare.gov platform. So any consumer who has changed their status on healthcare.gov or newly enrolled through SEPs on healthcare.gov for plan year 2019 will be included in that catch-up file and will be invited to come and claim their account. October 3rd, we'll be doing window shopping. So that's a pretty big date, and we'll talk a little bit more about that here pretty soon. October 11th is the last day that consumers who are logging in and completing the claiming of their accounts will be able to designate a broker before we have to put those changes into freeze. So consumers can continue to claim their accounts on, but they will be unable to designate a broker or opt into auto renewal after the October 11th date. October 25th is the last catch-up that we will be getting from healthcare.gov with getting new data for SEPs or any changes to enrollments that are happening on healthcare.gov. And I wanted to just break here for a minute and communicate something pretty important for this group of individuals. We know that there will be SEP enrollments, special enrollment period enrollments that happen after October 25th. That will be for plan year 2019. Those enrollments will happen on healthcare.gov. However, we will not be receiving any data on those consumers. So it's really important that you help us get the word out. If you're doing an enrollment and an SEP for plan year 2019 after October 25th, that consumer is also going to need to go to Nevada Health Link on November 1st and select a plan year 2020 plan. That information will not be imported from CMS. And then in terms of an update for our call center, adjustments have been made to ensure that our first call is not going, or that any brokers who get locked out of their call or their platform have an opportunity to get that address immediately on the phone with the manager in our call center. So there should not have to be any more additional calls out to get that resolved for you. We've also been nimble and quick on terms of adjusting our IVR in order to make sure that consumers who are just looking to claim an account get connected directly to an agent within our call center rather than being confused and connecting outwardly to brokers who don't have the capability to help them finish that claiming of account. That option to connect to a broker is still there. It's just not the first option. We've made account claiming the first option in the IVR. Wanted to give you some information. Our broker service line is, of course, active. The number is 1-800-547-8156, and we are currently helping brokers and CECs get their account set up and to help with account creation on that platform. That line is also available to brokers who are working with clients to help them claim their account. The client does need to be on the phone so that they can verify their identity, but you can use that service line if you are helping your clients to claim accounts. The broker support line during open enrollment will be open Monday through Friday, 9 to 7 p.m., and then on Saturdays from 10 to 3. And the support line after open enrollment or during SEP will be Monday through Friday, 9 a.m. to 5 p.m. Many of you have completed your certification and training and have completed the account profile setup, but we wanted to make sure that you know that if you haven't finished that, the window to complete that training is still open. We are working closely with brokers who are in the process and navigators and CECs who are in the process of completing that. Brokers are required to complete their profile on the Get Insured system, and Nevada HealthLink's call center is going to be able to support you with any kind of account creation questions that you have. And here's a little guidance in this slide for you. Navigators and our in-person assister points of contact have been established, and their entities are in the Get Insured system. After they complete MindFlash training, CECs or certified enrollment counselors will also be able to be listed within their respective entities. Nevada HealthLink's call center can support your entities with account creation or your points of contact with account creation, and we give you a little bit of coaching on how to get right in touch with the Consumer Assistance Center to do that here. For consumers to designate a broker prior to open enrollment, the consumer has to have an account. So if we are working with a new client, not somebody who's returning, who is not going to be able to claim account, they cannot designate until November 1st. But anybody who is a returning consumer who goes in and claims an account that is not already affiliated with a broker, they have an opportunity to designate a broker at this time. So consumers and brokers are populated from the migration from the federal marketplaces. New consumers cannot currently, again, create those accounts until November 1st. If an existing consumer already has a broker of record and that broker is certified and got certified in time for our August 9th deadline, then they will have a broker designated to them in the Get Insured platform. They will not be able to make changes to this designation, but if they want to make a change, they can do that effective November 1st. So I know some of you are talking about passing your books of business along to people, and I wanted to let you know that those designations cannot be changed in the Get Insured system until November 1st. If an existing consumer already has a broker of record from plan year 2019, but that broker did not get certified, they will not have that broker displayed as designated in their in the platform. And so that consumer has an opportunity to designate a broker in any one of their choosing. We're encouraging brokers to reach out to their consumers that were not included in our data migration from healthcare.gov and get them to designate you. So walk them through the designation process. If an existing consumer had no broker of record from 2019, they can designate a certified broker in the Get Insured platform. We have a video, and I wanted to just let you know that this video is available on our website, and we'll send out the link again. But this is a quick video that goes over the designation of a broker. It doesn't have any sound here because we're not savvy enough while I'm on the road doing this Zoom presentation to get that up for you. But I just wanted to show you, I'll skip ahead here. If you're, you can see that we've included screenshots and step-by-step information on how to designate, and then more importantly, once that designation is completed, we can walk you through near the end here how to accept, oh no, this is just from the consumer's perspective, I'm sorry. So this is not from the agent's perspective, but those are the steps that you can help your consumers walk through to designate you. On the next page, we're showing how you can accept your pending designation. So if a consumer has successfully claimed their account and then designated you as their agent or broker of record, you need to log into your Nevada HealthLink account and click on the Individuals tab, and then click on Pending, and you can see, I just messed that slide up. There we go. You can, if you go over to the action item, you can drop down and click on Accept, and the consumer will then move from pending request to active individuals queue. We are working on all sorts of references and manuals for you, and those references and manuals will be at this website, nevadahealthlink.com/partners-transition. We are going to have the Broker User Reference Manual, our Broker CEC and Consumer Application Enrollment Guide, and our EEF CEC User Reference Manual in the next week or so. Those are currently in the final clearance process, so we're very close to having those available for you. As you're aware, we have soft launched. Consumers are actively claiming their accounts. As of this morning, I saw that we had nearly 12% of our enrollment had claimed their accounts, and so we're looking, we're happy to see that number increasing, but looking to you to help us generate more claiming of accounts. And wanted to let you know that there's an important next key date for us, and that is next week on October 3rd. I can't believe it's October already. We will be making window shopping available. So consumers who are logged in will have an opportunity to do to shop all of the plans available to them, and anybody who is not a returning consumer will be able to access the same information and do some anonymous plan shopping or plan comparison, where they'll not only be able to see the rates and the plan benefit designs, they'll also be able to get an idea of what kind of subsidy assistance will be available to them. So all of this goes live on October 3rd. October 15th to the 31st is an important date for us. That's when we plan to run auto-renewal batch jobs. This is when we'll be freezing the option for consumers to do any designation or to auto-renew, to change their preferences to auto-renew for plan year 2020 and then ongoing. And that's because we're going to be running that job and we don't want to confuse any data. So that option for consumers to continue to claim their accounts will continue throughout open enrollment, but we do have to freeze the ability for consumers to make changes to their auto-renewal or designate an enrollment professional after October 11th. And that's because we'll be running this job the 15th through the 31st. Of course, November 1st through the 15th is when our new open enrollment period begins, first open enrollment period as a state-based exchange with the Get Insured platform. And our Peace of Mind advertising and outreach campaign begins really hard and fast on November 1st. Every migrated consumer will be able to then log in and make modifications to their application and enrollments, and new consumers will be able to create user accounts and designate enrollment professionals during that time. wanted to talk about BrokerConnect, which is an important tool and a new tool for Nevada HealthLink. This is a program for brokers who have opted in the Get Insured profile to receive referral calls via this BrokerConnect telephonic platform. We would love to see more brokers opting into this, and I wanted to take a minute and let you know that you can turn this function on and off at your convenience. You can also be very prescriptive about what hours you're available to receive calls. And so we're encouraging you to really consider getting leads from Nevada HealthLink by opting into the BrokerConnect tool. The calls always come from the 1-800-547-2927 number, and please make sure you add that to your contacts. Every broker the phone will ring for about 10 seconds, and if you don't answer, it will get transferred to the next broker. When you receive a call from BrokerConnect, please pick up as fast as possible so that we can make sure that consumer gets connected to a broker. We do encourage you to use your mobile number and not your office line, because we don't want things to get caught up in the IVR system. We want to make sure a consumer is getting directly connected to you. To be included in this program, you need to make sure that you go into your Get Insured profile. You need to sign up for the program by making sure that your client served is, that the box that says client served is checked in your account profile. And then make sure, again, that those hours of availability each day is noted so that we can make sure the program does not call you during those hours or outside of those hours. We have so much consumer communication coming at these folks here, and we're trying very hard to specialize it just to make sure that we're not overwhelming people, and appreciate a lot of the feedback we've been receiving from you all. But throughout the months of September and October, we will continue to send emails to every consumer who has not yet claimed their account to encourage them to find that access code and claim their account. We've seen a really good opening rate for those emails that we've been sending, and it has generated more and more claimed accounts every week. So we are seeing some progress from that. We will also be starting our Peace of Mind campaign and really focusing on how to get started with using or claiming your account. And these, of course, those of you who know, these are the steps that need to be taken. On October 1st, all consumers who have not yet claimed their accounts, we're going to get a second email or letter, depending on their communication preferences, to with the same activation code again. So we'll be able to refer consumers back to the email that was sent to them on October 1st or September 4th. So next week, these people are going to be getting another round of those emails. Then on October 3rd, like I said, we will be working on window shopping, and then open enrollment starts. We do have a tutorial on our website right now about kind of what Nevada HealthLink is doing and what it means to claim your account, so check that out. Okay, we received a lot of really great questions, and we just always appreciate these questions because it helps us provide outreach and education in areas that we may be missing. So please don't be shy when it comes to these. The first question was, can an agency have multiple brokers logged into a primary broker's portal? If multiple brokers attempt to log into a single broker's account at Nevada HealthLink, it will kick brokers out, and this may be problematic, right? Well, here's the problem. Brokers need to have their own individual accounts to enroll consumers. Nevada HealthLink is not currently set up to accommodate agency logins, and we are looking into a solution that can accommodate something like this. I'm sorry, getting distracted with questions, going back. I'm not going to look at those yet. So we are not currently set up to accommodate those, and I wanted to just let you know we are looking into an agency solution for plan year 2021, but for now you need to establish your own login and conduct enrollments through your own login or your own portal. A consumer will be canceling, here's the next question, a consumer will be canceling their coverage off of the marketplaces as of November 1st because they are aging into Medicare. It's understood to cancel them on healthcare.gov because it's a plan year 2019 cancellation, but assumes the data was already sent to Nevada Health Link, meaning Nevada Health Link's already received their enrollment. Is Nevada Health Link going to try to auto-renew this client that has already canceled? And the answer is because of that pre-scheduled transition data transfer between the CMS and Nevada Health Link, the consumer in that above scenario is going to be auto-renewed if they have the designation marked in their CMS enrollment data, meaning they've already opted in to auto-renewal. The consumer or broker will have to cancel the new coverage for plan year 20 on Nevada Health Link. Sometimes cell phones go straight to voicemail. We all know that, such as when we're in airplane mode. Will a consumer who's trying to connect to a broker through the BrokerConnect tool go get a voicemail? And if they don't want to leave a message or wait for a return call, what will happen then? So consumers who are will be provided with the following instructions in the IVR system. It will tell you to, when we're about to connect you to a broker through BrokerConnect, it will say, please hold while we attempt to connect you with a broker in your area. You may be directed to a local broker's voicemail. Please feel free to leave a voicemail for the broker to return your call, or if you need immediate assistance, you may call the Nevada Health Link Consumer Assistance Center at our 1-800 number and follow the same prompts again to be redirected or directed to an alternate broker. So we will be making every effort to allow consumers to, or encourage consumers to leave a voicemail. But again, we'll encourage you to answer your phone as much as possible, so make sure we don't lose these leads. And I will just say here that it's really important that you respond to those voicemails and make sure that you're setting up those appointments or phone appointments for those consumers' enrollment. All right, next question. Will calls go to brokers in differing orders so that the same brokers don't always get called first? The answer is yes. Calls will be randomized. Broker position on the list will not be dependent upon your answer rate. Next question. What happens if a person never claims their account? Will they still roll over? At some point, will their account not roll over and they could lose insurance? What happens if they don't realize what happened until after open enrollment is over? All consumers are, of course, encouraged to activate their accounts. We are not going to let up on that. We want everybody to get in and claim their accounts. But I will say that consumers who are eligible for auto-renewal on healthcare.gov will also be auto-renewed on Nevada Health Link, regardless of whether they activate their account. But again, we still want them to. Consumers who are not opted into auto-renewal must activate their account on Nevada Health Link in order to shop actively during the open enrollment period. Just as they would have had to log in to healthcare.gov to select a plan, they will have to log into Nevada Health Link to select a plan for plan year 2020. And we also just want to make sure you know that if a consumer goes to healthcare.gov to shop, they will be redirected to Nevada Health Link. Next question, will brokers be able to see statuses of their members as to who has gone and claimed their account so that we can encourage those who haven't? Oh, we appreciate that you are looking and interested in engaging your consumers to claim their accounts. Thank you very much. But unfortunately, because of the functionality and the one-time functionality of transitioning consumers from healthcare.gov to Nevada Health Link, we don't have a tool available to identify who has claimed their account and who hasn't. However, we are more than happy to assist with our limited resources, but we are way more than happy to do this for you. So if you are wondering about who has activated from your book of business, you can follow the directions here by sending us an email to Rebecca at this rlamazzo@exchange.nv.gov with an encrypted password protected list of your clients, and we will provide you with an activation status on those clients. All right, next question. Will a broker be able to download a data file of all their records? Yes. A broker can download the complete book of business by clicking on Export as Excel on the top right corner of the book of business screen. Next question. Will brokers be able to see the consumer's claim codes to assist their own consumers in claiming their account? It's possible that emails will bounce and then addresses will not be current. We totally understand that. How will consumers be able to get their codes if they don't go through email or mail? They have to call in. So Brokers, unfortunately, will not be able to see a consumer's claim code. These are personal information that requires personal identification to claim an account. So if the consumer cannot access the code because of email and they didn't get it, or they don't use the same email address, they don't remember what email address, they change their mailing address, they can always call. And again, like I said earlier, you can be on the phone with that consumer and call our 1-800 number to get assistance and make those claimed counts happen. So a consumer just needs to be available to identify themselves with personally identifiable questions. Next question, regarding an example where a broker, oh, this is a complicated one. Okay, a broker enrolled a child into an off-exchange plan on December 31st because the carrier extended that deadline for that, and at the same time that submitted a broker record change for the mother who was already on an exchange plan. The broker info would not be in the FFM. Will the broker be able to give Nevada HealthLink a list of missing members and proof that they are currently assigned to that broker by the carrier to have the broker info updated? And unfortunately, the answer is no. However, we have, again, provided you with the step-by-step guide on how you can walk a consumer through that designation process. And please visit our YouTube page or our web page where you can find that video and walk consumers through that. Next question, will every member who doesn't have a broker be assigned if they want to assign one? Brokers could end up with people showing up in their book of business whom they do not know, right? Correct, yes, and people could pick brokers just for the heck of it. Well, yeah, that is technically true. Consumers can pick people for just the heck of it, but every member who doesn't have an assigned broker is going to be given an opportunity to assign one during this brief period before October 11th, and they can, if they choose. And once that consumer designates a broker, again, the broker has the option whether or not to accept that designation. So when you go into that active or individuals and pending queue, you'll be able to see if someone has selected you to be their broker, and then you can accept that or decline that invite. Okay, so the next question is, when a person puts in a zip code to search, will the search be random like it was for healthcare.gov? And I assume you're talking about our broker directory, and the answer there is yes, the search is random. Next question, how will Nevada HealthLink be verifying residency? This broker said that they had heard something about the hub verifying. How do folks who just moved here but don't yet have driver's licenses be approved, or do they just attest? The FFM didn't require any proof other than an address, but off exchange, some carriers require driver's licenses. So Nevada HealthLink uses the address that is provided to us as proof of residency. An individual who lists a Nevada address within their application for their physical address will be permitted to enroll in a plan. And Nevada HealthLink will also comply with Nevada residency standards for NRS. All right. Next question is about attestation. Covered California allows folks to attest to income when data matching issues arise. The FFM did not allow for a simple attestation, and brokers and young adults out on their own and working for the first time who don't have income history have a hard time not getting pushed into Medicaid. They know they're going to make more money during the year and don't want to deal with Medicaid, and the same for contract workers who have fluctuating income. So Nevada HealthLink's application when seeking financial assistance such as subsidies is used and will allow for an estimate of an income for the entire year. We will allow consumers to self-attest to their income in the event that there is, and then if there is a data matching issue with the hub, we will ask for some documentation to potentially to require and reconcile that. But consumers, I wanted to point out here, and I'm sorry it's not written here, consumers who know that they don't, that look eligible for Medicaid, who know that they do not want Medicaid or that they are not qualified for Medicaid will be able to basically check a box that says I understand I am not eligible for Medicaid, that I might be eligible for Medicaid and that I want to continue on with my application with Nevada HealthLink. So we will not prevent you from moving forward with your application if you are, kind of on that cusp of Medicaid eligibility. People have been asking for test accounts, so I apologize that that function is not available, but we are working on our guides for consumers, and those will be available very shortly here, along with all of the plan data that will be available on October 3rd. All right. Moving on, we're getting close here, guys. The FFM gave 90 days to provide proof of documents and supporting income. Some brokers experienced cases where they uploaded data more than once and they never had it reviewed. The FFM is notorious for stripping away subsidies without notifying consumers until very close to the 15th of the month. In some cases, brokers helped consumers re-update and resubmit in time for the next month, but in many cases, the consumer would lose their subsidy for the entire month. So we wanted to let you know that consumers who are receiving APTC on Nevada HealthLink will have the 90-day grace period to become current, and that's in accordance with CFR. In the event that the consumer, in fact, does not turn any requested documents to remain eligible, they will be notified of their premium change and the loss of their APTC, both they're in their portal, and brokers will get a copy of those notifications. Consumers have the option to appeal their eligibility decision if they also have, and they have 90 days from the date of eligibility determination to make those appeals. If the consumer didn't turn in the documents and they have yet to be verified, they are still subject to pay their monthly premiums to the carriers. And the exchange assumes that the amount of people that will be impacted or that will have to go to the formal appeal process will be minimal. We know that this will happen to consumers, and we are very focused on making sure at our call center that we're verifying all of this documentation in a very timely manner, and that we're not letting people slip between the cracks and never reviewing material that's submitted to us. We will be very interested to hear from you if there are issues with that, so please don't hesitate to reach out. Okay, Medicaid is supposed to retro to the date of application, but some brokers have found since that children's Medicaid is always the first of the following month from when the enrollment is processed. If parents enroll their family in early December and the kids get pushed into children's Medicaid, but DWSS is busy and doesn't look at the file until January, there could be kids with no insurance. Some brokers wish Nevada had a provision, at least conditionally, to cover folks if Nevada HealthLink pushes them over to Medicaid until the application is approved or denied. Again, the exchange will allow a consumer to purchase a QHP even if we believe that they're likely eligible. So the consumer will be notified that they're likely Medicaid eligible, but will allow them to continue through the QHP application and enrollment. Another question, there are many times on the FFM where the information being provided to consumers, either the summary of benefits or the doctor lookup, proved to be incorrect on January 1st. A one-time special request to change plans in January for anyone who can show that they were affected by something like that would be nice, not to help lazy folks who forget to enroll forget to get enrolled, but a person who picked a plan and felt misled. This is actually some wonderful policy recommendations and exactly something that we're looking for from our brokers and stakeholders, and something that we would like to talk over as we start working on policy changes into Plan Year 21 and ongoing. All right, I can see that their chat is buzzing, and so let me try to go to the top here and find questions. Lots of people telling me they couldn't hear early on. Very sorry about that. Okay. Let's see. Can a consumer aging into Medicare stay on their ACA plan after the date they are supposed to go on Medicare, and how long? The answer is once Medicare is active, a consumer needs to cancel their ACA plan, period. What's the next question? Help me out here. How will supporting documents be sent to Nevada HealthLink, and how will the consumers know the status of those documents? the portal allows for the uploading of documents to be directly uploaded into the profile. So that should be included in our manual that will be out soon. It will walk you through how a consumer can do that and how a broker can do that on their behalf. Next, I'm sorry, I'm trying to catch up. All right. Can brokers enroll clients directly from the broker portal? Yes, we're very happy to tell you that you may enroll a consumer directly through your broker portal. You can complete the entire application and enrollment on your portal. Sorry, I'm getting some help with these questions. All right, will we know if the documents are approved or not? Yes, we will let the consumer know whether or not the documentation is sufficient, and the broker of record will receive confirmation in your portal on those too. Somebody asked about what it means when auto renewals are frozen. Consumers, yes, so consumers can continue to claim their accounts through October 15th through the 31st. They can continue to claim those accounts until the end of the year and ongoing. We just have to freeze their option to be able to, sorry, so many questions at the same time, my brain turned off for a second. We just have to freeze their option to make changes to their designated broker or auto renewal for plan year 2020. That doesn't mean, and that actually means on November 1st, if they want to get in there and change those functions again, they can go for it. It's just frozen for that 2-week period so that we can make sure we do a good job of our auto renewal process, which will happen during that time frame. All right. So I have some other questions that are coming up direct to me, so let me just see what else I can get here. If a client has activated their account but has not designated broker, can a broker look up the status of their application and make changes? No, not until November 1st. We are in agreement with Centers for Medicare and Medicaid Services that nobody can make changes to their application until November 1st. So if a consumer needs to make changes to their account right now, you can go to healthcare.gov and assist the consumer to make those changes there. How long do we anticipate it will take to enroll a new client, to include account setup and completing payment? That's a good question, and it'll depend on how complicated the household is and how complicated the consumer's information is. And so let me try to get a sense from our user acceptance testing folks on what the average is, because we're running scenarios on all sorts of different complicated households, and I'd be happy to provide you with that in a follow-up. Okay. If a client is on auto renewal, how would that member be notified that new documents need to be submitted to proof the said document? Those folks are going to, if they have a broker of record, the broker of record will also be receiving notifications that documentation is required for that enrollment. If they are not, that consumer is going to need to check. This is why we want people to claim their accounts even if they're opted into auto renewal. They will still be auto renewed, but they're going to need to access Nevada HealthLink account to make sure that all of their documentation is up to date. Does a new account need to be set up for a client if we are enrolling them directly from our broker portal? No, you can complete the entire enrollment application and enrollment from your broker portal. If a broker portal is missing a broker is missing some of his clients and the second and third download from healthcare.gov doesn't bring them over, how are we going to get them into our system? Okay, so this is something that we have had brokers report to us that they had missing people from their book of business. This is a small number of folks that are experiencing this, and we've gone and checked every one of them in the data that was migrated from healthcare.gov. And in every circumstance, the number was either wrong on the application at healthcare.gov or it was not there at all. So the data migration is the source of truth. Brokers who are missing folks from their book of business need to work with those consumers to get them to designate them before October 11th, or you can wait until that November 1st when you start when we start renew or open enrollment. You'll be able to work with them to get them to designate you during that time. Unfortunately, we just don't have the ability to make changes because that's the source of truth and we're not allowed to make changes to it. So we have put together some tools for you and are looking forward to walking. If you have any questions about that tool, we're more than happy to help you. Rebecca and I and Ryan have been answering lots of questions about this, so please don't be shy to reach out to Rebecca. It looks like we are winding down here. I got the one question here. The 90-day grace period to pay premiums will not be a rolling 90 days. Is this correct? Consumers are going to continue to have to pay in full prior to the 90th day of the premium grace period in order to avoid termination from the carrier. That is correct. That does not change. Another new question here. If we sign a client up directly from Broker Portal and has a personal account, will they connect the client so the client can see changes? Yes. The client will be able to see all of the information in their account. Yes. Okay. I think I answered all of these. So if there is an opportunity for you to send us more questions, please don't be shy. Thank you for joining. Yes, I'm so glad I had an opportunity to talk to you. I wanted to let everybody on the call know that we got a call from CMS today from healthcare.gov letting us know that they accidentally sent out a memorandum to Nevada consumers. Not every Nevada consumer got this, but some Nevada consumers got it. It's a memorandum of open enrollment on healthcare.gov. So we will be issuing information to consumers and to our carriers, letting them know that this was an error. Healthcare.gov will be sending a correction notification to these folks, letting them know that that notice was sent in error. But please help your clients understand that that was not correct and that all enrollments for Plan Year 20 will be happening on Nevada Health Lane. We'll be sending out more information via email, but I wanted to take advantage of the opportunity with all of you on the phone to get that